Great jam. A little bit down, but it's good. 7:39. Dr. Hoa Nguyen. Doc, it's been a minute. Good morning.
Good morning. Are you running for the governor?
No, I'm not. You know I don't like running. You're my doc.
Just kidding.
Good morning, Doc. Let's just get right into it. It's good to see you again. But I just wanted to ask, is COVID over?
Yes, I think COVID is not completely over, but I think we are starting to see that we are back to normalcy already. So I think that I anticipate the next 2 to 3 weeks that, the last hurdle is the mask will be somewhat optional. So hopefully that will be so we can see people on face again.
Doc, when we talk about masks optional, right? In what settings do you think that masks would be, or do you recommend that masks would be required?
I think it should belong to the business. Every business can make decision if they want to continue to implement the mask or not. Just like at our medical center, we will continue our masks until we feel comfortable that we can protect all our patients. But in the restaurant or the business, it should be the business decision of continue the mask or not. So especially open air, they should have the mask on open air.
Doc, I know that we were doing good here. We're coming out of this surge. There was just a lot of projecting, and I think you actually again hit it on the head when you talked about how long this surge was going to last. I know we interviewed Dr. Berg in mid-January, and he said February 1st, if we were lucky, that we'd start to see this surge come down. You disagreed. You said no, another 6 to 8 weeks, which is exactly where we're at now.
Yeah, it's just based on our population here and based on history, and based on the data we have in the state. So we just every one of us make the best guess, right? And and that's what we are right now. So 6 to 8 weeks out. So we it's in March now. So I think the number continue to go down. I'm very confident it's going to continue to go down, and the hospitalization continue to go down. So I think that at this point, despite you see the surge in Korea and Japan, we're still going to be safe. For this whole BA2 at this point, so we are still protected already.
Yeah, I wanted to ask. That was actually my next question. Is South Korea here reported 429 deaths and 621,000 new COVID cases, and from what I was reading, it's a mix of Omicron and Omicron 2.0.
Yeah, I think that's the key. Is that this the Omicron at this point, and Korea they make a decision of because economy, they decide to open up and their country there, and that's why I think the BA2 are taken over. But just like everyone else, as long as they can handle the hospitalization, they should be fine. And there's going to be a steep curve coming up, and hopefully the steep curve coming down.
Yeah, Doc, so you're saying we're safe from this. Do you think that's because we've already had the stealth variant, the 2.0, and the Omicron kind of run through our whole population?
Yeah, once you get Omicron BA2, you kind of, your immune system is there. So a majority of us, I know we have about, 30,000 plus people get infected. For everyone to get infected, there's at least 1 or 2 more out there get infected. So I think the majority of our population have been infected by the BA2 already. So yeah, even we have the tourists come in, I feel like we are still safe because the immune system is still there already. You can't be reinfected by the same variant. So we'll be okay.
Doc, I wanted to get your comments on this Operation Homebound, and then the hiring of former Senator Dennis Rodriguez as the chief health advisor for the governor, and he's talking about health disparities and getting out into some of these underserved and financially struggling communities and bringing healthcare. Your reaction to that?
The Homebound that's gone out of the beginning of the COVID surge, where we reach out to the indigent population there that they cannot have access to care. So I think that if anyone can continue to do that, it's very good. It's not just the vaccination a testing program. Now that should be not the primary, but the homebound should be to try to educate the indigent population that you go through and try to assist them and apply for any type of COFA Medicaid or our local Medicaid. So whatever we need to do is to make sure that these people have access to care, and that's the most important thing. Like I tell you yesterday, I would say thank you for Lieutenant Governor Josh Tenario on taking my call yesterday, because I see a patient that's 62 and she's had a stroke, she's had hypertensive, she had cholesterol diabetes, but she applied for Medicaid, she got denied. I just say, holy cow, how can you deny a person like that sitting in front of you? So we need to do extra effort and make sure that these people complete the paperwork appropriately the first time, because most of them don't have the ride, most of them don't have the phone, so do we really need to make an extra effort in helping them if we're going to want to cut down this disparity of healthcare in Guam, right? I mean, you look at her, I was really don't have a word to say, and I would like to say thank you for Lieutenant Governor to take my call, and he stepped in and assisted on this patient. But that's what we need when we go out there. If they miss a piece of information, a piece of paper, make sure we follow through with that. I think that's our responsibility to ensure that these people have them, and not just denied, but they miss something.
Right.
And I think that whoever take over the homebound program, they should know what the limitation of these people and try to help them the best they can.
Right. And obviously, Doc, I know not everyone can get the Lieutenant Governor on the phone to kind of rush things through. So are you saying that with Operation Homebound, a good idea would be to have an outreach where you get these public health people with the Medicaid, Medicare, whatever, and you say, hey, if you don't have insurance, come and apply and sit down here until we finish this paperwork and we can tell you if you're eligible?
100%, Chris. I think public health should be heavily involved in this one. And, this is where, if they don't have the insurance, don't have, especially guys, COFA Medicaid is 100% federal fund. It doesn't cost going from zero. And if these people end up in the hospital, you and I, own the taxpayer, are paying for it. So it's important to reach out to them for their health care, for their access. Also important because it saves us money, right? The federal did that. They give us 100% coverage for the FSM. We got to use it. I know. I think Mike Sinicus, he pushed the program through. It's just now the local people now, our local DPHS need to get involved and ensure that we educate this population and help them and try to even out the access to care for everybody.
Right on. Doc, so when we're in these, and I don't want to say lull because that kind of leaves it open for another surge to come, right? But when we're in these, it's dying down and the cases and the hospitalizations are coming down, what do you think is the most important thing for us to be doing as a community right now?
I think the most important community right now is look back the last 2 years and see what we need to do. Look at our mistake. This is where we have to kind of admit that we've made some error and readjust and get ready for anything that comes to us the next few months or next year or so. The COVID is almost out, so hopefully they don't have any more variants come down the line. But we should really boost up our healthcare system in Guam, the hospital, the private clinic. So far, I know the hospital is maximum improvement, but I really encourage the administration to work with all the local healthcare clinics, try to help them and update their facility just to make sure that they are ready to keep the door open on the next variants or whatever pandemic we have come down the pipe.
Doc, I wanted to, because Sabrina actually had the governor on the first episode of the Hot Spot, and she asked the governor about the hospital at Eagles Field, and the governor said it's a done deal, at least on her end, and they're moving forward. They're gonna try to put in a VA clinic, Guam Behavioral Health Wellness, public health facilities, and the new hospital. I guess I don't know if we've asked you before, but your thoughts about a hospital in Manila.
This is my personal opinion. Okay, I think the hospital in Manila is not a very good location. It should be in the central somewhere. Most of the physician clinic, especially the most important is OB, they are in Tamuning, and for an OB doc to run all the way up to Manila to deliver a baby, it's not the most efficient way to do it, and every second we wait for the baby to come out is a life at risk. So I think that anywhere that we build a hospital, we need to kind of communicate with the local clinic and see where they are and get their opinion where to put the hospital. I say that own the OB clinic and own the major clinic are downtown in Tamuning, and it's very hard to kind of put a hospital, away from them. We had to build around the clinic where the majority clinic is. It's good for AMC Manila, right? We're there already. But for the majority of our physician clinic are in Tamuning, and the hospital should be somewhere around there. But that's my opinion as a physician. Yeah. If I'm going to be in the hospital should be very close to my clinic. It's very hard to move an existing clinic already, where they are for many years already.
Yeah.
So I think that the hospital should be, I have nothing in writing. So I think that everyone should be rethink about where the location of the hospital it should be. But to me, it should be somewhere around Tamuning or Dededo where the majority clinics are.
Doc, was there ever a point where the governor's representatives or the governor's office had a loop had said, "Hey, docs, what do you guys think about this new hospital? Where should we put it?" Was there like a survey where you guys ever asked your opinion?
No, I don't think that any, especially any large clinic like the Tier 2 clinic, have been involved in any planning for the new hospital. But I think that we should involve the provider, the physician, in this new hospital, because bottom line is we are the healthcare provider, and we will have access to a hospital. It's very important that our patient go there. So the more convenient that for us to go to the hospital, especially first OB, those babies can wait. When they want to come out, and just like Sagar right now, Sagar would take 3 minutes to go to GMH, and Dr. Shea is right there in 2 minutes. So those guys cannot drive through Guam to go to Manila. It's impossible. So those are very important decisions that wherever the hospital would be, they have to answer those questions.
Thank you for that, Doc. Last question here. I know that we've been texting a little bit about this whole controversy with the Guam Board of Medical Examiners and sorry, and Dr. Nathaniel Berg. I mean, I'm hearing, Doc, that he has just got a lot of the doctors just going crazy with some of these comments that he's making publicly.
Yeah, I think the medical boards have some restriction where they are, but I think that for us, for this particular case, the physician as a whole, our main goal here is really protect our patient, right? I mean, that's 100%, and I think open communication with the patient at the absolutely the must of anything that we do. So I think that if anyone have a complaint, that we have to sit down and be able to give the patient a chance to talk. I don't know what the regulation of the board, but to me, patient's complaint should be heard and we need to give them a chance to talk, right? I mean, it's not a one-way street; it's a two-way street. Even from our arbitration law, the main complaint of this the patient is that we don't have a chance to talk to the physician, the provider. So to me, our responsibility is to the patient and not to the provider. And we need to let the patient talk and explain the situation and work through, and it should be an open book, So to me, I think Dr. Berg, I think that's an opinion from him and not from the medical board. I think that a few of them have spoke out, and to me, it should be, all this case should be handled on a timeline. That's what I would do, just to put a timeline and say, hey, after a month or two, it needs to be done and wrap and complete. Because the longer we stretch out here, it really doesn't look very good for the physician and our healthcare system. We really need to be very transparent. And like I say, the number one goal is protect the patient at all costs. We will need to be more transparent to the public.
Doc, there's actually a petition being circulated to remove Dr. Berg from as the GBME chair. Did you have an opinion on that? That's the wonderful part about living in a free country, Chris, is that people have all the right to do that. So I think that if they feel like someone, because we all, when we're serving those things, we are a public servant, right? I mean, it's a volunteer, but we're still a public servant. And if the public feel like we not doing our job, and they have the right to do that. So I mean, I think there's a lot of challenge on the board. I know it's a lot of things, but I think that we can all do better. If we don't admit sometime that we have some weakness and we don't make room for improvement, then it's not going to be good for everyone. Yeah, Doc. I mean, I when I hear Dr. Berg's comments, I mean, he just really seems hell-bent on implementing a lot of what the law says. But I really believe, well, like you said, that if we do post up all these things that the law requires the GBME to post on their website about the records of doctors, it's not like we're going to see, 500 doctors that, killing patients or whatever. I mean, I really agree. For the most part, we do have some really quality physicians on here, but it's just the ones who aren't that, we need to watch out for.
Yeah, I'm surprised that we don't have a lay person on board. I think that any type of medical any kind of board that involve people, involve the public, should have some regular people on the board. To me, the public should have a voice on any type of board that involves the public. So I would put one or two people in the public that volunteer to be on it, just to make sure that there's transparency, and then also make sure there's a voice of the public on the board. I know there's a lot of physicians. I know Phil Flores is there, but absolutely no regular people on the board. Even the GMH board, that have a regular person on the board, just to be the eye and the ear of the public.
Right. Doc, thank you so much for your time this morning. It's good to catch up with you.
Okay, guys. Have a good day and be safe and enjoy the new normalcy.
Thank you, Doc.
Bye-bye.
Right on. There you go. So the takeaways on the COVID end, Doc said COVID over? Not necessarily, but we are returning to what he called a new normalcy. He said, South Korea has seen a record number of positive cases reported. They also saw over 400 deaths reported yesterday, I believe.